September is Suicide Prevention Awareness Month, a time to raise awareness to a very important topic. Lauren Moyer, Executive Vice President of Clinical Innovation at Compass Health Network, is here to shed more light. Thank you so much for joining us today.
Yeah, thank you for having me.
Now, of course, this is an entire month dedicated to raising this awareness. Why is this so important?
We are losing individuals at a very high rate. And so Suicide Prevention Month is about building that awareness, about building education to our communities, and knowing the signs and symptoms of suicide, because suicide is preventable.
Yes.
And it's okay to not be okay.
And what are some signs, specifically maybe even for parents, that they can look out for?
Yeah, so any kind of dramatic change in behavior, if your loved one or an individual that you're close to starts to sleep more or sleep less, if they start to give away their possessions, if they start to have more direct communication of, I'm hopeless, I'm depressed, I don't want to live anymore, right? That's definitely a high alert thing.
One of the biggest things that's happened right now is this new hotline number, 988. And can you just touch on why this is such a big deal?
It's really the first time in over probably 2-3 decades that our behavior health crisis system of care has really become the focal point. It's not your traditional outpatient or inpatient services that have historically been able to be funded, but we are truly putting a lens on all the gaps that people have fallen through in our healthcare system. And 988 is really the impetus to that. Not to mention that when you're in a crisis situation, your executive functioning, your thinking, your behaviors of scheduling, going to work, that's off. That's thrown out the window. So 988 is a quick 3-digit easy code to remember, and you need that.
Just like 911, an emergency, 988.
Yes.
It is that quick thought, and hopefully more and more people can know that and recognize that number for what it is and reach out. And now when it comes to crisis centers, because a lot of times it is that moment when you're in crisis. So before you even get to that point, what do you offer to avoid that?
So we have now opened in Wentzville, as well as 10 others throughout the state of Missouri, a behavioral health crisis center. And it's truly an alternative to jail or a hospital emergency room. Open 24/7, 365. It's a no wrong door for any kind of behavioral health issue that someone might be struggling with.
Yes, Lauren, well, thank you for coming on the show and sharing this and broadening this conversation that, of course, needs to be had not only in September, but in every month.
Yes. Thank
And if you could take a look at your screen right there, if you or a loved one are in crisis, again, call 988 or also 888-237-4567. For more information, you can visit compasshealthnetwork.org.